Welcome to the run series on the Arc. So we're going to look at this amazing piece of equipment and look at how you can really enhance thoracic upper back movement in rotation and extension and create great stability through pelvis and up into spine. So we're looking at core stability, which is the ability for your body to anticipate load, the right amount, and also it's a neurological kind of muscle awareness of the spine as well. So you won't ever hear me telling you to tighten, pull and zip up, because anatomically that's not how we are wired. I'm going to give you all the skills to be able to cue your nervous system, because it's far cleverer than you are, and then that way change will happen, so that when you're out running and you're hitting, the feet are all set up because we've developed them to be able to absorb shock. Your pelvis is the foundations of your spine, so we've worked a little bit on this, but then the core stability is the spine is the other shock absorber. So the ability to have this amazing mobility and stability of the segments of the spine. Because we don't want a rigid spine, we want the spine to be able to do all of the things we know it does in our gait, but we want to be able to stabilize within our mobility, yeah? And we talk a lot more about that in our anatomical workshops, so do check in with them. The more you know, the more you kind of stay motivated and empowered to do this work. And do it in this way. There's lots of ways of coming at Pilates out there, but I'm really interested in how our body really truly works for change for the good. So looking at how to cue your nervous system, how to cue how to set you up to understand how anatomically we are governed and work, and how are you working, how is your kind of movement in anatomy compared to where it would be better served, and how we get you from one place to the other. So come and notice your sitting bones. Sitting bones are the bony bits that we sit on, and most of us don't sit that great, so we're going to look at that as well. Have your feet spread and grounded, hip socket distance, and not as wide as your pelvis. You're going to come in where your hip sockets are, which is in here, and just come and sit. And do a little bit of breathing, and I want you to breathe from your chest to the back of the pelvis here. So can you breathe in? And just feel that your breath travels down the full length of your spine, and breathe out. And you're just breathing normally. You're not like increasing your breath dramatically. It's just a normal breath. So we're really going to improve the ability for you to breathe. So your run, cardiovascular wise, will definitely benefit from it. So breathing in through your nose. Feeling that your rib cage moves and expands, and your belly expands. We're not holding the belly in, and we breathe out. And of course, when we run or when we're lying on our front, there's other ways to breathe as well, but for this purpose, we're trying to breathe all the way down to the sitting bones and to the tailbone. And then you're just going to reach, notice your feet. I want to send my feet forward, and notice if I send my feet forward, I just go back. And you want to maintain height, but come off your sitting bones a little bit, and let the sacrum, the weight of kind of your abdominals and your sacrum, just go back into the barrel. So I find my kind of long C spine, not a shortened one. And then I could just reach the arms forward. I'm going to keep my eye line forward. I'm not going to bring my chin to my chest. I want to feel that I'm reaching and filling up the front, like I'm almost standing into my pubic bone a little bit. So I want you to reach your feet forward and create space at the front of the pelvis, and then let all your organs, all the weight of your sacrum, take you back. So that the lower back, the mid back and the head all go back at the same time. We are in our natural C curve. We've not compressed the spine here. And then you're going to send your rib cage back into the arc, send the sacrum back into the arc, and when you get to kind of the bottom of the sacrum, just spread the sitting bones and fill out through the front. A lot lot of detail in that, but we're going to keep going. Feet reach forward. It's like my feet are on a broken down travelator, and I feel like I'm sliding them forward, and then it's about here. I haven't done it. You see, I've got to let my sacrum drop. There it goes. Drop to the back of the body, and then I can find that lovely kind of lumbar curve, which we're looking for here. So we're looking to take the extended lumbar into flexion, not to increase the flexion of the thoracic. That's just going to stay the same. And I want to feel that I've promoted axial elongation in this way. And then the reason for using the arc is to send your rib cage back and feel it wide and spreading, and then roll the sacrum back to bring you up and you fill out. You can just relax your arms down. We're going to do that a few times. Breathe out. Let everything just soften back. Roll like a cog of a wheel, the pelvis into the barrel, onto the sit bones, fill out through the front. And my eye line stays on the horizon the whole time. The back of the head is falling back with the rest of the body. I've got one more there. Feet first. Really involve your feet. Wait for your hips to create space, and I'm going to do what you don't want to do. And then as I come back, because I see it a lot, and you can see if I do it. So I'm on my sitting bones, and I see this. And so I've compressed my spine, and we don't want to be doing that, because we know that when we elongate in our curves and we create stability of our mobility, then we're in our strength. That's what we want to achieve. So we want to mobilize with wonderful space. And in flexion here, I'm looking to take, it's the lower back that's going to join in the curve. See if I've got my head of the rest of the spine. So to here, nice job. And then just interlink the fingers and place them behind the head, and just let your jaw kind of hang from your ears. And my feet are glued. And I'm having to, if I let go of everything, I'll go into extension. So I'm having to send the curve of my lower back back intentionally into the arc to hold me up. And then my center's working. And I'm finding it's like I almost want to lift my head up off my spine. My arms are deep in their sockets. You won't be doing flexion if you're recovering from a disc pathology, your acute stage, or although you shouldn't be doing this just yet if you are acute. And you won't be doing flexion if you've got osteoporosis, osteopenia. There's lots of other things you can do. Osteoarthritis, fine. Yeah, pregnant, no. There's things that you won't do. So I'm just noticing the lower rib cage on the arc, and I'm just rolling across the back of it. So I'm still, head is heavy. I'm focused on the back of my rib cage, and I'm sending it back in its curvedness. And then I'm going to come up. Wow, that's enough of that. I'm not trying to intentionally hold myself up. You're going to your neck extensors. I'm feeling this spread back, and from the back, I get my up. Nice job. So now you could come on to the side here a little bit, and we're going to look at that thoracic mobility and breathing that you need. So you're going to come and drape yourself over here, and just let the hip just drop that way, and your head is going to drop this way. Can you see I've like this part is nicely fanned open. I'm going to get my other hand out the way and just let my jaw relax, everything hang. I'm just going to breathe into my upper rib cage. I'm going to be patient with it. You can have your legs straight if that's more comfortable for you. Have everything stacked that you have two of. You hear me say this a lot. So hips, shoulders, ears. And just breathe into that rib cage. And each time you breathe out, feel the weight of the pelvis dropping down and sinking versus the weight of the head dropping over in the other direction. Just a couple more there. Let your jaw relax. Be patient. These small exercises that don't, you're like, oh, come on, come on. These are the ones that are going to really help you breathe well on your run. So drink it in. Go with the ease. Know that doing all of this is going to make your run amazing. So I'm going to do a little bit, we're over. We're in a bit of lateral. We're in a little bit of over. We're going to take it into a little bit of extension. So from here, from this shoulder blade that I'm laid on, I'm going to send it along with the rib cage towards camera. And if I send, and my intention is that is rolling towards camera, I'm going to look up a little bit. And then I'm going to send it back. Yeah. I'm going to stand into my bottom leg to lift my top leg. And the next time I do that, I'm going to let this leg counterbalance and come forward. And then I'm going to reach the leg long and back as I roll this way. My bottom leg is active and I'm trying to not move from the arm. I'm moving from my underneath rib cage. And here I've got to let my head go heavy. And I'm finding the length not from the front, from the back of the leg. And just do one or two more. We don't need to do many of these. Be heavy and draped and then just let them kind of go. Find the leg coming forward and you going back, leg going back, you're rolling forward. Breathe in, breathe out, just enjoy. Keep active with your underneath leg, relax with your head, and then come and drape here. Take the hand all the way, keep supporting your head actually, and open up. You could bring this leg in front actually now, and just have a little bit of weight to the legs. And let the arm guide you now, so it's like you're scooping the arm, you're going to keep looking at your hand, follow it, don't go too fast. With your eye line, try not lift your head like I just did, just glance. And then come all the way back up by sending your rib cage in to the arc to come back up, and just have a little stretch this way and just breathe into that side. Awesome, we're going to do the other side. I am going to flip the arc around so I don't have my back to you for all of that, but I'm going to get quicker through it because I've done it the other side, so we know what we're doing. So finding that height, that length, getting comfy. You want to come down the centre of the arc, reaching the leg away, and just allow yourself to be here, leg bent or straight, and you've got to give time for like your head, your pelvis, your breathing to have an effect on the spine. And the arcs are such an amazing piece of equipment if you can have them at home. I've got my reformer in front of me and my arc here, and they're just, it's amazing what you can do to. We do Pilates not to get good at Pilates. I do it because I absolutely love it. I love this kind of exercising, but I do it so I can like do life. I can do what I love doing outdoors, whether that be walking your dog, playing with the grandchildren, biking, swimming, running that marathon, just being able to feel energetic and present in your day. I also like it to get rid of like the kind of natter, clutter of the mind. I'm just enjoying this right now. So from the rib cage, I'm going to just send it back and then send behind me. So I'm trying to move like I'm on a spit, and I want the underneath rib cage to come around and up to my legs reaching heavy, and I'm trying to drape. I'm trying to let go. It's quite here, and then I spin and turn my underneath rib cage to come forward, and then I'm going to stand into my bottom leg to lift my top leg. So by that I mean I'm going to push it down and this just pops up, and then I'm going to see if I can still stay with that same quality of turning my rib cage to bring my leg forward and forward to wherever you can keep your pelvis stacked, and then scoop and reach and come back. And then once you've kind of got the quality going, and you're breathing and you're draped, then you can kind of speed it up a little bit and really use the arc. We're on the arc for a purpose. You've invested in it. So don't try and do it all yourself. And it's not that you're cheating, you're getting more out of your body. You're teaching your body to have this amazing ability to move in rotation and extension, which is what we want when you run. We're going to improve your breath. We're lengthening into the whole sling by involving the leg, and we can evolve it and to bring it into lots of different ways. So bringing, stacking, and taking the arm here. So you're just going to start, and you might start kind of here to begin with, let your jaw relax. You want to kind of just close your eyes and just go with that movement. Really notice the rib cage and try to relax. It's a hard bit, yeah. And through that relaxation, you'll get all that lovely juiciness and openness in your tissue of your body. And then just sending the rib cage down to come on up. And just have a little bit of a stretch and a breathe into that bit there. So you're going to come around, you're going to pop the end bit of your, it's like a jigsaw of this off, and just pop that to one side for now. And you're going to come and work with this for a little bit of extension work. So have your hands either side of the arc and your rib cage closed, and then just kind of drape and let your rib cage open out to the ceiling behind you. Feet can just kind of have your feet flat and just breathe into the back of your body. So you want to feel your spine is the same shape as the arc. And it's going to really help you open up and stretch into your back without even trying to go there. Head's hanging, legs are relaxed, jaw is relaxed, arms are relaxed. Just sending the breath into the back of the body, into the back of the rib cage. So you're trying to inhale and feel the expansion behind. So take the hands now to the side and get them where you feel you've got space to move. And just wiggle the legs out a little bit and stretch them. And you can still have the knees soft and you're on the front, not too wide. So I'm going to gently press my feet down and let the back of the head raise up. My eyeline will come to the front of the mat. So I'm just kind of horizontal with the ceiling at this bit. My rib cage is still closed at the front, and I'm as long as I can get, and I'm trying to have a buoyant head. And then I'm just gonna get long, let your kind of your pubic bone reach around that way as the head comes around this way. So you've got longer. Breathe in, breathe out, and then on your next out breath, feet reaching down, head reaching long and away. So you pop up to here. And then I'm going to carry on. I'm going to allow my collarbones to smile and breathe into my chest. So coming to a little bit of thoracic extension. And I'm pulling myself forward with my hands a little bit, and they're still bent. And then I'm going to get as long as I can to come down a little bit. And I'm not going all the way this time. Inhale, get as long as you can. Pull the mat underneath you. Let your collarbones pick up. And then it's your breath down the front of your body that kind of fills you up and takes you up. And then exhale and come down. Inhale. Make sure you actively pick up your collarbones. Smile them wide. Exhale. Come down. Now I'm going to reach my arms back this time, picking up the collarbones. And just hang out here and just do a little bit of meeting gravity with the very top of my upper arms. Head is floating, I'm breathing into my chest. Trying to breathe wide and out the side as well, like I've almost got gills. And you could just keep the collarbones picked up and long. Good. And then come down. And just do a little bit of breathing here again into the back of the body. I want you to tuck your toes under now. Get all 10 toes tucked under. And just let the knees bend. So this time as I breathe in, I'm reaching the heels back and the crown of the head forward. So my feet are tucked under now. My pubic bone is on the barrel, my hips are wide, and I'm promoting length through my spine by just gently drawing them out this way. I've not extended it more here. This is still the same shape, and I'm heavy with the front of the pelvis. And I'm going to let one knee dip, and then I'm going to swap. And what I want to do is it to be a heel led exercise. So I'm really reaching back with my heel and then letting the knee reach down. So one knee reaches down and one heel reaches back. And I'm just holding myself up by pulling myself through my arms. And you can feel kind of the walk of the pelvis now. So this movement up through the spine. And you can kind of go with it a little bit, so let the rotation happen into the thoracic. So we're going to, as the right knee dips now, lift the chest to the left. And then you're going to come around and swap. So I'm just exaggerating my run, yeah? If you slow down enough, you'll feel it in your body which way you need to rotate. And I'm just letting one collarbone kind of smile back and the other one just, so it's like I'm being picked up with my collarbone, yeah? And if we were running, the head wouldn't be going, the head would kind of be looking forward as you kind of do this, and then dive down, really let your pelvis heavy around the barrel, head heavy on down, and just spend a few minutes breathing into the back of the rib cage. You can untuck the toes, come and bring yourself up. You could do another nice stretch here and breathe again into the back of the body and release on down. And then just roll yourself up. Stay as long as you want, releasing over there. So this is an amazing piece of equipment I've got a whole series working with this piece of equipment to enhance and support and strengthen your spine. And we do a whole leg series on it as well. So enjoy working with it and do treat yourself to one, and see you real soon back in our classes on demand. Keep dipping in. I'm here for you. Now I'm like, oh, my body feels so good. People need to do this. So I preach it, I shout it, from any soapbox I can get on. Please do tell people about it and share this kind of work with them, because it'll really enhance what they do and keep them safe and injury free. Thank you very much. Take care. Have fun.